Bismillah ar-Rahman ar-Rahim. It is just gone 7 after 11. Welcome back. Pardon, not news and views. I've taken a half a break from that program, but mid-morning show with me, Julie Ali, and we are now joined by Dr. Nabeel Adam to talk to us about, all I can say is revolutionary stuff, unbelievable, but let's get him on the show and get him talking. Dr. Nabeel Adam, Salaam Alaikum, welcome to the program. Can you hear me loudly and clearly?
Walaikum salam. How are you doing?
I'm good. You are coming through very clearly. Thank you indeed. I'm really amazed by what I've read regarding this device, which is called a quantum magnetic analyzer. Can I ask you if you actually were behind this? Did you develop it? Did you come up with a concept, the idea, or is this somebody else's invention?
Well, it started a very long time ago, but it's obviously been through the years. It's been developed, and it's obviously getting better through the years. But not many people have exposure of the machine. So obviously, it's been in a process where it's been years since it's been developed. So now is the time that
So
it's
you are not the inventor.
no.
You are a medical doctor. Let's understand why you believe that this is going to revolutionize the medical industry, so to speak.
So basically, I've done a test on myself. That's how I really got into it. So they called me up to check out the machine. I've done the test myself, and I was like, wow, because I've like matched it with like actual medical tests and like blood reports and things like that. And it was 100% accurate. So it was a good all-in-one comprehensive report that was spot on.
Tell us more about it. What is the machine is called a quantum magnetic analyzer. What exactly does it measure? How does it work? And how much time do you spend with possibly the machine being hooked up to some part of your anatomy for you to get all of those results and readings?
So basically, it's called a quantum resonance magnetic analyzer. So basically, it's like a small box which you connect to your laptop, and there's a small like rod or stick that you connect to that box, which the person obviously that's going to be doing the test has to hold. So how it basically works is that our body has energy going through it. So once there's a change of energy, that causes diseases or illnesses. So basically, the machine is set to a normal person's energy with regards to like everything that it has, like basically in your heart, in your liver, in your gallbladder, in your pancreas, or whatever. So once once the person obviously holds it, you just have to hold the rod for a minute, and it basically scans and analyzes all of the relevant fields. So once it's done the scanning, a report will come about what's happening. So what it does basically test is basically everything from head to toe. So basically all your organs, your heart, your liver, your kidney, your liver, your gallbladder, your pancreas, from your vitamins to your bones, to your hormones, to your eyes, collagen. It even goes down to check something as detailed as your memory and water shortage. So it's a good, very comprehensive test.
What Gosh, this sounds magical, absolutely magical. And here I'm sitting here thinking that obviously for young people, and even children for that matter, if this is as good as it says, or as good as you making us believe that it can so accurately pinpoint, uh, I should imagine predispositioning, um, predisposed conditions in your system, that you can then start addressing it possibly by medical intervention or dietary change. What are other medical practitioners saying about it? Also, you take then this report, because I presume a report is generated, and you then go to the different medical professionals and say to them, this is the report I have got via the quantum magnetic analyzer. This is what my medical profile looks like. Can you start treating me? Will they take me seriously enough? Number one. Will they want to run more tests, which means it's going to cost me money? And number three, will they be able to treat me according to that report that I have from the magnetic analyzer?
Well, as a medical doctor, I don't think other people have to be open-minded, firstly, about this test, because it's obviously not a conventional way or method where people are obviously thinking that we have to take bloods, we have to do like an MRI or CT for certain types of issues. So people have to be open-minded to a change. And it's obviously been around for a while, but doctors haven't been using the machine. So obviously they don't have the knowledge about the machine and how good it is. So obviously it's taking a step in a different direction. That's what I'm doing. So obviously it can prevent a lot of issues from developing in the future, where we actually need to do a lot of invasive type of treatment and stuff like that. So with a lot of the people that I've tested and seen like the results of, like we've done like blood tests before they've done like blood tests based on issues that they've been having, and we've done a test and it was like 100% accurate on both ends, which was showing us the same type of stuff. Well, the quantum resonance goes beyond that point and tells us that we have to actually, it shows us like stuff that are building up. Like just say something like cholesterol. So basically your total cholesterol, your HDL and your LDL and all of that, that's your total cholesterol makeup. So obviously that will pick up on a normal cholesterol or blood test. Whereas in the quantum resonance, it shows you that total cholesterol, and it also goes to the point where it shows you cholesterol crystals developing. So even if it's not at the point where your cholesterol is high, it shows you that cholesterol crystals are developing and things like blood fat developing. So before you get to the point where we have something like cholesterol, we can actually bring it down before we get to the point. So it's also a good preventative, even if it's not there already. It's a good preventative test to do. That's why it's a good test for everyone to do, and that's the best way to move forward.
So obviously, this, as I've said in my introduction, this is really revolutionary stuff. It's going to revolutionize the medical industry. That is, if you get buy-in from everyone, from all medical practitioners. But by the same token, it's going to put a lot of medical people out of work, because from what I'm picking up from what you're saying, there labs, where you forward your blood samples to, won't be in business any longer. Radiographers won't won't have jobs. So there might be a pushback. Would I be correct in saying that? Because we're
Yes,
talking about job losses.
yeah, I think that's why a lot of people, like doctors, wouldn't support it. But I'm obviously trying to make people, at the end of the day, becoming a doctor is about obviously helping people and trying to make the person as healthy as possible. So I'm obviously trying to make a change in people's lives. But obviously other doctors are not really going to agree with me, because it's going to obviously put a lot of people out of business if people actually listen after the test. But I guess we have to just do what we have to do to make it
Okay,
better for people.
I want to know why you, Dr. Nabeel Adam, are you a GP in private practice?
So I haven't been doing like GP work. I've worked in a hospital before, and I've got this machine like during COVID. I've come across the machine and I've tested myself, obviously, as I said before, and like I was amazed with the results of it. So I don't want to be continuing doing the normal GP type of work. So I obviously just went into this machine, and it goes into intricate details of the body, which I thought was amazing and great way of setting people's lives up from
Okay.
from the time you are young till the time you get older. We can obviously sort a lot of things out. So
So,
what has been
all
happening?
right. So, by way of this machine, you could become the type of doctor that would help people change their lifestyles. Um, when they come to you for a consult, for example, you'd be able to give them a report, and based on that report, you could start working together in preventing future diseases. Having said that, what about? All right, I'm really intrigued. So, where do I go to for such an assessment? What is it going to cost me? And post the assessment with the report in my hand, would I be able to go to my doctor, to my specialist, and say to him, "This is what I have. You need to start treating me."
So basically, what happens is the cost behind it. So the test, why I would say there's three reasons for good reason why we should be doing this test. It's quick. So basically, the test just takes a minute, just 60 seconds to hold on to the stick, and we get that amazing report of yours. Then we go on that it's non-invasive, which means we're not taking out of any clothes, we're not taking any blood. All we have to do is just hold the stick. And it's basically cost efficient. So basically, I'm a mobile service for now because during COVID, it's obviously a bit better for people and more comfortable for them in their own spaces to do the test. So it all just based on it's not really an expensive test to do. I would say it will save
What
them a
in
lot
your
of money.
All right, in your mind, what is not expensive? So I'd then call you to come over
Yeah,
to my
yeah.
house, or I'd probably come to your home and have the test done. What's it going to cost me?
So it just depends on which area you're at as well, because I have to obviously add a fuel cost and things to that.
Okay,
If
let's
you're
take that
based
out of
around
the.
if you're based
Carry
around the Joburg area, it's around 900 to 1,000. And
on.
then if you go into Pretoria and other cities, it's obviously a bit more to 1.2 to 1.5, but that's about it.
All right. It would make sense for you to have a group of people in a particular area getting together, and then for you to run the tests on a group of 5 or 10 people. I should imagine that would be more lucrative, or would make much more sense for you. But that being said, has medical aids recognized this? Could I then claim back from my medical aid?
I don't know how medical aid would feel about it because it's obviously going to put a lot of doctors and stuff into business. So I don't know how they would feel about this machine that's obviously giving you a breakdown of everything in your body and obviously sorting it out. So obviously where it goes from the test is we get the report. I obviously discuss the issues that we have.
Mhm.
And then I give a suggested treatment and diet program with the report based on the issues that we have. So it's basically everything in one. You wouldn't actually need to go to anyone else unless we have like a serious type of issue where we need like surgery and stuff like that, or if stuff isn't like really working out. But on a general basis, things have been changing for people. We've seen like changes in a few months, obviously with the lifestyle change, because it obviously doesn't happen overnight. It takes a bit of time to change your lifestyle. So we've been seeing results after like 4 months of obviously the suggested type of treatment and diet and lifestyle change.
Okay, so you are suggesting right up front that in terms of dreaded diseases and anything surgical, uh, the patient would then have to go to a specialist. But if someone comes to you randomly and you pick up that they've got issues with cholesterol or any such things, high blood pressure or dietary issues, you will then, according to that report, be able to work with them, treat them, and in a few months' time, do a comparative report, another session with the magnetic analyzer, and then make a comparison to see the difference. If they've been model patients and they've followed all of your recommendations, you are saying that way it can and will work.
Yes, definitely for sure it will work. But it obviously goes beyond the point of just testing cholesterol and blood pressure. It goes into much more detail, whereas small things add up. So basically, it also checks all the status of our organs, like something like the power of our left ventricle in our heart, or our coronary artery flexibility, or our blood vessel flexibility. Or it shows you like things like liver fat, so your fatty liver, like people's fat in the liver, maybe it's building up, or maybe the detox function of the liver, or the bile secretion, or the energy production from the liver, or even like kidney, where you can see uric acid building up in the kidneys. So certain types of things, or even the bun index in the kidney. So it's an amazing test to do. It also shows you like your vitamin levels. So like your vitamins from A, B1, B2, B3, B6, B12, C, D, E, K. So it shows you the levels of where it's sitting at and what we need. It also shows us our coenzymes like nicotinamide and pantothenic acid, folic acid, glutathione, basically all of that levels. Also goes into detail where it shows us our trace elements like calcium, iron, phosphorus, selenium, cobalt, iron, magnesium. Basically shows us the levels of every single thing in our body. Even goes to our eyes, where it shows us our like dark circles and wrinkles coming along and this visual fatigue, eye selectivity. It's just great.
Okay, you talk about the eyes. What about people suffering from possibly glaucoma, or maybe they've got very thin retinas, and there might be a situation they're very myopic. They're not even aware of the fact that they've got issues around their eyes. Maybe the start of a detached retina, etc., etc. Does it pick up all of that as well?
Well, on
Can it
that
pick up all of
scale,
that?
on that scale, that obviously they need to go to a specialist based on those certain types of issues, because we would obviously feel the difference in our eyes and things affecting our eyes. But this goes just to a general scale of our eyes on a normal individual that doesn't have a bit of complications in their eyes or
All
certain
right.
things
So
like.
you are saying that where there are complications, you would then rather suggest that the patient goes to an ophthalmologist or some sort of a specialist. What then are you saying to me? What do you pick up? Because you mentioned the eyes. What is it that is picking up as far as your eye health is concerned?
So basically, things like dark circles, like obstruction, it shows like lymphatic obstruction, or certain like edema, swelling in the eyes. So it picks up in the machine, that type of things. It shows us where the eye selectivity, if it's high, we obviously, visual fatigue comes in. So our eyes get tired if we're using our eyes a lot. So in certain things like that in the eye, it'll pick up all of that type of things. So it's showing us that maybe our organs are not 100%, because our organs, our kidney, liver hits directly to our eyes.
Mhm.
So that's basically
Okay,
what it's showing us.
absolutely fascinating. Are you the only person in the country with this machine and very excited about using it and testing? your patients, and showing them the outcomes and showing them that there's a possibility they can get better and they can prevent the disease from progressing, whatever it might be? Or are there other healthcare professionals who are as convinced that this is the way to go?
I haven't met a doctor that does the same thing that I've been doing yet. I've yet to meet one. So I think there's certain types of wellness people that have this machine, but they have like different types of ones. Like there's something called a Scio machine, and like there's another one that you attach to your head and stuff like that. But I don't really have a lot of knowledge about that one. But I don't think I've come across any medical doctor that obviously does this, because they just go into the conventional method.
Okay. Is this quantum magnetic analyzer being used elsewhere in the world? You are very vested in this. And
Mm.
obviously, you've done all of your research. So, where else is it being utilized, and what sort of results and feedback are you getting regarding this device in other parts of the world, obviously?
So basically, I think it was invented by a Chinese guy. So in China, if you look at Chinese people, like Asian people in general, they usually have a long life. So they don't even age much. So they've been basically set on like basically using this machine. So their results have been amazing because they obviously last a bit longer in life, because they live to like 90s and like hundreds and stuff, because they've
And in
been
good
like,
health. And in
yeah,
good health.
in
Mhm.
good health. The most important thing is your quality of life. So basically, the quality of life has been great, and they live till a long age, which we always obviously want, with quality of life obviously there. So far that I've known, it's probably only China and India. The other countries are obviously not being exposed much to it, and they obviously probably wouldn't go because you said a lot of people will be out of jobs. So, so I don't think a lot of people will be
Okay.
open to the idea in a hurry that we want to help them straight away, because other people will obviously be out of jobs.
Sure,
So,
sure. Okay, I can't expect you to give away all your secrets on air, but how did you happen on this, this machine and realize that this is really the next best thing as far as medicine is concerned? Um, because surely there must be one or two other people in the country using it, unless, of course, you came across it on your travels.
yeah, so basically I studied in China. So I graduated with my medical degree in
Ah,
China. Yeah. So I studied there for 6 years and I graduated there. So obviously, I have like contacts around the world with regards to medicine and stuff. So you obviously talk to a lot of people about what's new and what's happening. So obviously, there's people that is there are like certain type of wellness people that are probably doing this test, but they obviously don't have the medical background of it. They're just doing it as a wellness perspective. So they can't go into detail where they check, obviously, that it could result in specific diseases and things like that. So I came across this one company in South Africa, and they called me and they were like, we have this machine that basically checks everything in your body. So I was like surprised by it, obviously, and I was intrigued. So I took myself to the test, and from there on, it was just, I was like, I have to start doing this because it
okay.
was 100% accurate.
How are family and friends and the community responding to you and this modality of treatment or assessment and then treatment that you are offering?
So um, everyone's responding well to it, because the people that have been testing, they've been like happy with the test. Well, they've not been happy, but I mean, they've been like happy
They
with,
agree. They agree with
yeah,
the
they
outcomes.
agree with the
Okay.
outcome of the results, and
Okay.
they are happy to move in a way forward from the results. And there's a
Okay,
lot of
Dr.
people.
Nabeel,
Yeah.
let me tell you, let me suggest this to you. I think you need to do a test on me, and then
Okay.
I need to come back on air, and I need to verify. I need to tell our audience that, hey, that is magical. He's certainly putting his money where his mouth is, or oh no, that's just another gimmick. So you need to do the test on me. You need to carry out this test so that we can come back on air and we can give the facts to the people. Are you up to the challenge?
Definitely up to the challenge.
Okay, great
Because
stuff.
I can safely say I've been to the Citizen newspaper recently. They've also asked me about this and they were like, no, maybe it's just a gimmick. So they've actually done the test and then they've written an article now about me saying how great it is and obviously the service. And so, yeah, I'm ready when you are.
Right. So we'll be in touch. We'll be in touch soon. You can
Yeah,
do the test, and on one of my future programs, I'll get you back on air, and I can share my findings, my feelings, my perceptions, and we can take it forward from there, inshallah.
inshallah. Yeah, that's the best way moving forward, I think.
Okay, I'll give you a minute or two to wrap up. This is fascinating, undoubtedly, but a
Yeah.
minute or two, whatever else you want to share with our audience, the floor is yours.
Yeah, so I think the test would be good for like everyone to do, especially with the lifestyles that we lead these days. We obviously need things that's going to take us to that optimal level where we need to function. And there's a lot of bad habits that we as people develop over the years. So I think it's a good test to do to open our eyes. We shouldn't be scared of it because the answer that we get usually when we need to say, oh, I'm too scared to do the test because what if I'm dying? That's the famous line. What
Listen,
if I'm
we
dying?
we are all, you and I and everybody else, we are all 1 minute closer to our deaths in any case. But that being
Yeah.
said, I did say it was the final question. One more question. What about pregnant moms? What about someone who just has fallen pregnant or thinks she might be pregnant, or maybe, halfway into her pregnancy is worried about symptoms that she is presenting with, and she's afraid that she might, lose the baby, that she might miscarry. Is the machine able to pick up on all of that?
So it's obviously that is a miscarriage is not basically going to be telling us, obviously, we don't have knowledge about that. But it can obviously tell us the health of the person, how we can keep us strong enough to keep the fetus and baby growing in a strong environment. There's only one contraindication. A person with a pacemaker can't do the test because obviously the levels will, I mean, the energy
Yeah.
will affect his pacemaker. But besides that, I think a pregnant woman would benefit from the test because you'll obviously tell her about her health and what does she need and certain vitamins to keep herself strong, to keep the baby to grow strong, obviously.
Okay. I know I did say it was the final question, but I do have one more. You talked about a pacemaker. What about someone with a stent?
No, a stent should be fine. It's only a pacemaker that's contraindicated. And we usually start testing kids from 12 years old. If we have to
Okay.
test, if we have to test a kid from below 12, if they are able to hold a stick tightly for a minute, then we could do that, and it'll pick up obviously things like ADHD,
Oh,
stuff
wow.
like yeah. So
Oh,
it picks
wow.
up. So it wouldn't give you like the state of all the organs as yet because you're obviously still developing. But from 12 years old, it will obviously show us the organs health and whatever the adult report is. But from before 12, it shows us like things like ADHD and vitamins and allergies.
Wow. Okay,
Yeah.
Nabil, unfortunately, my producer is pointing a warning finger at me. I've
Okay.
gone way over our interview time, but I'm going to take you up on that challenge. We're going to talk some more and we'll come back on air, and I will then either verify or say, that's a gimmick. But let's wait and see what happens, inshallah. Lovely talking to you. Till the next time, inshallah. Assalamu alaikum to you.
Walaikum salam. Thanks for having me.
Pleasure. That was Dr. Nabeel Adam talking about this amazing device. It is called the quantum magnetic analyzer. I've challenged him. I've said to him that we need to do a test, and I kind of have an idea of my health status. So let's see what his report suggests. And based on that, I'd be able to say, it's a gimmick, or I can say, gosh, I am amazed. I'm blown away. But that's going to happen in a couple of days' time. Stay with us. It is exactly 11:37. This is the Mid-Morning Show with me, Julie.